Hello, PsychU community, and welcome to today's webinar, Mental Health Journey, Voices from Individuals with Lived Experience on Self-Disclosure, Recovery, and Hope. Thank you for joining us. My name is Becky Wong, and I am the Medical Science Liaison with Otsuka Pharmaceutical Development and Commercialization. I will serve as the moderator for today's discussion. Today's webinar is brought to you by Otsuka Pharmaceutical Development and Commercialization Inc. and Lundbeck LLC, committed supporters of the mental health treatment community. In kicking off our discussion today, we might ask ourselves, why does mental health matter in the US? Well, according to the Mental Health America, 1 in 5 American adults will have a diagnosable mental health condition in any given year. And 50% of Americans will meet criteria for a diagnosable mental health condition sometime in their life, with half of those individuals will develop the condition by the age of 14. Mental health also affects the older adult population, and most concerning is that 5% of older adults are living with a serious mental illness. And people age 65 and older accounts for 17.9% of suicide deaths. Caregivers of people with mental illness are also affected and have a higher percentage of reporting of emotional distress as compared to caregivers of individuals with a physical condition. With all the data that I just presented, I'd like to now hear from our speakers. And I'll start first with Caroline. What are your thoughts on the statistics that I just shared about the caregivers?
So I think it's always really surprising to people when they see statistics like this, just because mental health is something that's so unspoken about and so unseen. I think it's always really striking to people. What I want to talk about specifically is caregiving. So we see here that caregivers are also at risk. It's not just people living with a mental illness, it's also caregivers. I've seen this both personally and professionally. So personally, as someone with a mental illness, which I'll talk about more in a little bit, my husband and my mom have been my caregivers over the years, and I've seen how they have been more prone to, like this says, high emotional stress, symptoms of depression, psychological distress. And then professionally, I've seen it. So I work with patients at end of life. They come to hospice home and I serve them and their families. I've seen patients come with severe mental illnesses and their caregivers are just so fatigued, so stressed, and I love that I'm able to offer support to them, but I've seen just how prone they are to that. I think what's important is to normalize that experience and validate people that it's okay to feel caregiver burden and caregiver stress. And I think it's important too to recognize that resources and education and support are so important, not just for people living with a mental illness, but also people who are caregivers.
And John, what's your overall thoughts about the prevalence of mental health conditions in the US?
I think one of the things that we can see from this slide is just how common mental health conditions are. And what is worrisome about that is that I think that there's a lot of people that we are still not reaching. And that has to do with a number of things. I think that there are issues around access to treatment. And as we know, stigma plays a very big part in getting in the way of people accepting treatment and being accepted by the community to get that treatment. So in the midst of this COVID pandemic, what we actually have had develop is a mental health epidemic. Our suicide rates are elevating, and we have reason to do a lot more work, that we have ahead of us. The only other thing I'll share about this slide, which I think is really notable, as Carolyn said, is that mental health journey is not a solo one. We take along with us, those of us who have lived experiences, we take along with us our family, our friends, and sometimes our colleagues on our journeys. And they can be enormously helpful, and that can be challenging for them at times as well. So those are my thoughts about the statistics.
Thank you, Caroline and John. And Dwayne, is there anything else you would like to add?
Well, I agree with both Caroline and John. And I just want to mention that these statistics also show how emotional distress is not marginalized. It's not specific to any one group of individuals. And as John specifically mentioned, this whole COVID-19 response, which we've been experiencing for the past year, really highlights how prevalent emotional distress is. So it begins the discussion of how do we address the stigma and discrimination with against individuals with a diagnosable mental illness.
Thank you, everyone. And it's apparent that mental health matters for everyone, and it's critical that individuals with a mental health condition seek treatment early. But that's not always the case, and many individuals with a mental health condition finds it hard to disclose their mental health status with someone. Here on the slides are some of the mental health self-disclosure challenges and barriers. And the first two bullets on disapproval of one's mental illness and also being discriminated against opportunity, these really resonated with me because individuals that I know who have a mental health condition have shared those concerns with me. And during the registration process, we added some pre-registration questions, and our goal was to gain insights from the PsychU community around just how impactful stigma might be for individuals that you are taking care of. And majority of the respondents indicated that they agree to strongly agree with the statement that individuals with mental health condition finds it challenging to disclose their condition. And based on my experience, I too strongly agree with the statement. So John, what are your thoughts about the results from the respondent?
Yeah, I'm very not surprised because as a doctor living with bipolar disorder, I come at this from two perspectives. On the one hand, I have had a very personal journey, and in the medical community, we all know that there is much stigma against doctors who have mental health conditions. Doctors are very worried about external repercussions in terms of their response from their colleagues and issues around medical licensing. But I come at it from a perspective as a clinician too. And so many of the clients that I've had over the years have real concerns and have had to jump over lots of very real barriers. These are barriers that they're not in their head. They are very real barriers. There are barriers that have to do with how friends and family will respond. There are barriers that have to do with employment issues, being denied, advancement in employment or even being fired. And there are housing issues involved. So I think these are high hurdles for people to jump over. And I think I give incredible credit to so many of those who have lived mental health experiences who jump over those barriers.
Thank you, John. And Caroline, can you share and maybe provide some personal experience around having increased anxiety due to self-disclosure?
Sure. So I live with bipolar disorder. I was diagnosed at age 18 and I became symptomatic at age 16. Initially, I was both relieved and distressed to have that diagnosis because it felt nice to have a label, but I was also fearful of being labeled. So I kind of experienced catch-22, I guess, for lack of a better word, where I would feel anxiety over telling someone and being judged or labeled, but I also had anxiety over not telling someone because I was afraid that they would misunderstand me if I didn't tell them. So it was just really, on one hand, I'm really on either hand, anxiety. It was just really a struggle.